My name's Ranjit Samra and I'm a Sexual Health Registrar at Melbourne Sexual Health Centre. HIV is a chronic disease, and as we enter the 5th decade of the epidemic, we can see that there have been significant developments in diagnosing and treating patients who are living with HIV. My research specifically looked at primary prevention with post-exposure prophylaxis. Now, this is a pill that's available, has been available since 2005, and if taken within 3 days of an exposure and taken for 28 days, it significantly reduces the risk of HIV acquisition. More recently, in 2016, the rollout of pre-exposure prophylaxis has changed the face of HIV prevention. Again, it's one pill, the same pill as PEP, that's taken prior to a potential exposure, and this has very high efficacy. My research looked at the difference in the demographic of people accessing PEP in the last 11 years, from 2011 to the end of 2021. And this neatly captured the rollout of PrEP in 2016. We wanted to see if the demographic of people accessing PEP had changed with the rollout of PrEP. My research involved looking at data collected over the last 11 years at Melbourne Sexual Health Centre. On arrival, all patients are invited to complete a questionnaire that provides us with demographic information on their age, sex, country of birth, year of arrival to Australia, and some details about their sexual practices. We then looked at this data for the last 11 years, and we saw that unexpectedly, PEP consultations hadn't reduced with the rollout of PrEP. We expected that it might, given how popular PrEP is, and we then dug deeper to explore exactly who was accessing PEP before the rollout of PrEP and who was accessing it afterwards. What we found was that there was a decrease in patients born in Oceania accessing PEP since the rollout of PrEP. And there was an increase in the number of patients accessing it from Asian countries, specifically Thailand, China, and India. This highlights the disparity of PrEP access in those who are Medicare eligible and ineligible. So therefore, it's really important that we specifically target this demographic when it comes to preventing HIV transmission. Here at the Alfred Hospital, we have a PrEP Me clinic, which is available to those wanting to access PrEP but don't have Medicare. What this research highlights is the need for more of these clinics across Victoria to ensure that more people who don't have Medicare can access PrEP. I'm hopeful that with the rollout of more clinics like the PrEP Me clinic, we will see a reduction in HIV transmission and therefore a reduction in the prevalence of HIV in our community.